What constitutes negligence in paramedic care? Have you ever wondered what happens when a paramedic's actions lead to a negative outcome for a patient? Understanding negligence in paramedic care is essential for both professionals and the public. Negligence occurs when a paramedic does not provide the level of care expected from a reasonably competent paramedic in similar situations. This can lead to harm for the patient involved. To determine if negligence has occurred, four key elements must be established. First is the duty to act. Paramedics have a legal obligation to provide care when called upon. This duty is based on the professional relationship formed with the patient. They must follow accepted standards to avoid causing unnecessary risk of injury. Next is the breach of duty. This happens when a paramedic fails to meet the expected standard of care. For example, if a paramedic neglects to check vital signs, does not perform necessary interventions like cardiopulmonary resuscitation or oxygen administration, or handles a patient in a way that worsens their injuries, this could be seen as a breach. The third element is causation. It must be shown that the breach of duty directly caused the harm suffered by the patient. This means proving that the injury or worsening condition was a foreseeable result of the paramedic's improper actions. Finally, there are damages. Actual harm or injury must have occurred due to the breach of duty. It is important to note that not every bad outcome indicates negligence. The paramedic must have failed to act as a competent professional would in that situation. In emergency medical services, the standards of care can vary based on available resources and technology in the community. However, many basic procedures remain consistent across different settings. There is also a higher level of negligence known as gross negligence. This occurs when there is an extreme disregard for patient safety. An example would be refusing to treat a patient in critical condition or making reckless errors that significantly worsen their situation. Gross negligence can lead to more severe legal consequences. Paramedics work in high-risk and unpredictable environments, often under pressure and with limited information. This is similar to other high-risk professions like logging or deep-sea fishing. Despite these challenges, paramedics are expected to maintain a standard of care to protect patients from further harm. Legal protections exist to shield paramedics from liability in many cases, except when there are willful or grossly negligent acts. To avoid negligence, paramedics should perform thorough and timely patient assessments, apply appropriate emergency interventions, safely handle and transport patients, document care accurately, and stay updated with protocols and continuing education. Failing in any of these areas can lead to negligence if it results in patient harm. Understanding these legal responsibilities is vital for paramedics who face unique dangers and pressures in their work.